Today we have with us Dr. Omar Watson, a board certified oral surgeon. In today's episode, Dr. Watson shares some valuable tips on oral health, but that's not all. He's got an important message at the end for the community, which I believe we all need to hear. By all means, listen in. You can find out more at www.oralfacialsurgery.com.
Thank you so much for listening to this episode of Earrings Off. We want to invite you to subscribe, rate, and leave us a review. You can find us on Facebook at Earrings Off Podcast and on Instagram at The Earrings Off Podcast.
Welcome to Earrings Off. I'm Lou.
And I'm Teresa.
Okay, we have with us today Dr. Omar Watson. Welcome, Dr. Watson, to Earrings Off.
Thank you for having me.
Oh, absolutely. Dr. Watson, can you share a bit about your journey to becoming an oral and maxillofacial surgeon and what inspired you to choose this specialty?
So, oddly enough, when I was younger, I always had the interest in science and math. I knew I wanted to be a doctor, but
Really?
I knew pretty much middle school, high school. My dad started getting some medical ailments kind of early, diabetes. He smoked like pipes, which was actually pretty darn cool. But, I would be like, Dad, you shouldn't do this because I read this,
Yeah.
But I was always a very passionate and emotional kid. And I thought, you know what? I don't see myself having sick patients in my hand. If something happens, I don't know how I can handle it emotionally. Like I really thought that. So I always liked going to the dentist. The dentist was really nice. I didn't mind the sounds. I thought it was kind of cool that they had their own business and they were part of the community and they're doctors, right? So
Yeah.
I was like, what? I think I like dentistry. So I did 2 externships in high school. We were required to, the high school I went to, and off I went to college, went to the pre-dental curriculum. I was a little skeptical at first because I was like, why? You get there, you like, why am I doing this? So I took a little, and I recommend any parent of a child that's not sure what they want to do, or even, someone who's entering college like my son, taking an assessment test of the careers that might suit you. So I took that just in case, and it came back dentistry and business. So
Wow.
yeah.
Okay.
So I ended up going to dental school, and once I got to dental school, I realized that I loved the profession of dentistry, but I did not love cleaning teeth or fillings. I actually liked the medical side.
Yeah.
So it was kind of full circle. I didn't mind, the whole pager thing back there. It was pagers, you're on call.
Yeah.
And so that's how I ended up, choosing. Well, I feel like the profession chose me because I was really late in saying that I wanted to do it. And it just God kind of blessed me to go through the doors and succeed in it. So.
Wow, that's amazing. And you also make me think about my sad little life, Dr. Watson, when at that age, all I was thinking about was how I was going to skip the next class, which sort of explains where I am. But this is not about me. Okay, this is not about me.
I feel
I had fun though. Don't trip. People know I was like the cool nerd. It was like, did you know he was a scholar? Because I was at the parties. All
Okay. Too much, Dr. Watson.
Oh, I'm sorry. No, I'm telling go like, work hard, play hard. Just work hard.
Yeah. I believe in that too.
So I feel like you were chosen because I have never heard anyone say that they love the sounds of the dentist's office. And I'm going to tell you, that's the number one reason why I hate the dentist. Because of the sounds. I mean, you walk in there and it's like, oh my gosh, that's going to be me in just 2 seconds, I'm sure.
And I had rock hard teeth, my wife says. I never had cavities. It was literally I go in there, get my teeth clean, talk to the hygienist and all that stuff. I mean, that was it. So I didn't have a cavity till I was in my 30s.
Yeah.
Wow. Okay. So, would you tell us about some of the most common procedures you perform? And And what should patients know before undergoing them?
Yes. As an oral surgeon, I do the bread and butter procedures. One of the procedures that the most common that we perform is wisdom tooth extractions.
Mm.
Also, dental implants. I do a lot of singular dental implants, full arch, like replacing all of people's teeth, bone grafting, corrective jaw surgery, which is called orthognathic surgery, and facial trauma. I don't do it as much as I did when I was in Detroit and earlier in my career, but I still do a little bit of trauma.
Mm.
And I do a lot of stuff with pediatrics. For whatever reason, I kind of made somewhat of a niche with that, with the bedside manner. And I guess I look
Okay.
young, so I do those procedures as well.
Wow.
Okay.
Wow. Okay. So, Dr. Watson, you referenced wisdom tooth removal. So, do you have advice for patients who may be preparing for this procedure and how they can ensure a smooth recovery?
Yeah, so preparation for surgery and recovery are key because preparation, your doctor is not there with you, and recovery, guess what? Your doctor's not there with you either. For me, obviously, as a surgeon, I can tell them what happens during surgery. But in preparing for surgery, it's important if you're going to be sedated not to eat or drink anything at least 6 to 8 hours prior to surgery. This is for anesthesia purposes. It's important to, if you have antibiotics that you're recommended to start taking, that you take that. That helps to decrease the incidence of infection. And I tell people it's really a lot of it is mental. Just like she
Mm.
said, no one wants to come see me. You know, like at
Yeah.
least if you come see me, I'm probably gonna be animated. I'm probably a little more animated than other people. I crack jokes. I know what I'm doing. I have two doctors, but you have to trust the process. Like you have to be able to talk to yourself and trust the surgeon and look them up. If you don't, then you should go see,
Yeah.
someone you do. But
Yeah.
the mental game in terms of being prepared is very important. Now, after for most patients, it feels like, oh, I went to sleep and I woke up and it's done because you don't
Mhm.
see everything that I do, obviously, during the
Right.
surgery.
Right.
After surgery, when you wake up, you will not have pain because you will be numb during the surgery. You will be numb for about an hour. And I give the evidence-based medication that is necessary to
Mhm.
alleviate pain post
Mhm.
surgery. And you
Right.
take that around the clock to stay ahead of the pain. The biggest mistake I see people do after surgery is they feel great. So they're like, oh, I don't need the pain medicine. And then the
Mm.
pain starts and they can't catch up,
Right.
or they
Right.
take it when they get home, then they go to sleep and they don't wake up to take the pain
Mi-
medicine at the interval, which is every
Right.
6 hours.
Right.
So then they wake up in pain.
Okay.
Mm.
Yeah.
So those are the most common things to think about
Mhm.
perioperatively with wisdom tooth surgery.
So pain management is critical in
Very
this. Yeah.
critical.
Yeah.
Yes.
Yeah. Okay.
So many people don't realize how oral health connects to overall health. Um, and it's important. Can you explain why this is so important and how oral surgery can play a role in improving overall well-being?
Yes. So just a little bit about me. I have my doctor of dental surgery, but I also have my medical doctor. I did medical school, have my license in medicine as well, practice under my oral surgery license. Um, One thing that I learned because I went to medical school after was that most MDs do not learn about oral health. They don't know
Mm.
anything about the teeth. A lot of times, if a patient has a fever and they go into the hospital, they don't even think that it could be coming from a necrotic tooth or something like
Mm.
that. So
Mm-hmm.
it's important to connect the dots, right? So systemic health, meaning your whole bodily health, it starts with the mouth. I mean, you're consuming foods.
Mm-hmm.
There are bacteria in the mouth and in the whole GI tract. And it's important to have a good oral health because that can affect systemic things in your body like heart disease, diabetes, um, and gum disease is actually linked to inflammatory markers in your body. So
Mm-hmm.
having a lot of inflammation in your body from things that you consume or having just inflammation from chronic infection can affect your arteries. It can affect um, the walls of your arteries in terms of them becoming more stiff, having atherosclerotic plaques. It's a bigger connection than people really understand and pay credence to. So, it supports your overall wellness to make sure your oral health is intact.
So, Dr. Watson, what are some common myths or misconceptions about oral surgery? And what tips can you share to help patients feel more comfortable, less afraid, more prepared?
So I think some of the common myths is that it's extremely painful. Like that's literally the most common myth is I'm
Hmm.
going to be in pain. And I have a family member that's close to me who had a knee replacement,
Hmm.
and it was uncomfortable, but pain medicine works actually.
Hmm. Hmm.
If you
Yeah.
take it right, it works.
Yeah.
And so paying attention to how you treat your pain is going to be the most important thing, I think. I always tell people to ask as many questions as possible. Don't be scared to ask your surgeon questions because guess what? It's a free country. You're the one making the informed decisions. No one is
Yeah.
forcing you to do anything. You need to make sure you feel comfortable and that you understand in layman's terms what's going on with your body and yourself. And if they can't explain it to you, then you should get someone else to explain it to you.
Mhm.
And then, just kind of is reiterating, but just following the preoperative and postoperative instructions. A lot of people, we give written instructions, we give verbal instructions, we have instructions on the internet, and I always tell my staff that don't discount how much we know as health professionals. You know, you can have
Mhm.
someone who's a politician, a lawyer,
Right.
or
Right.
a mechanic or anything that's very, very smart in their field, but their dental IQ is low, and that's
That's
okay.
an excellent point.
Yeah,
Yeah.
and that's why I have a lot of student loans to be able to tell them what to
Yeah.
do.
Okay.
Makes sense.
Yeah.
So, what is that one piece of advice you wish more people knew about maintaining teeth and gums?
Well, you're talking to the wrong person because I'm a surgeon and I take the teeth out. But I will put my dental hat on. I haven't worn for 20 years and try
That's
to
right.
ask it.
That's right. Yeah.
So, okay, I always tell people this. I do like smile. I smile a lot, and when I'm serious, people think I'm mad because I'm not smiling. I smile a lot. But a smile is not just teeth. The smile is your jaw structure, it's your bone, it's the spirit at which you smile, it's the shape of your mouth. And that is what oral maxillofacial surgery is. It's not just your teeth. We do jaw surgery, we do cosmetic surgeries, we do rhinoplasties, we do neck stuff,
Wow.
we do a lot of stuff, right?
Right.
Everybody doesn't do everything, but we, as oral maxillofacial surgeons, we look at things more comprehensively.
Mhm.
And so, in terms of maintaining those things, it is important for your overall function. One part, you know, um, connects to the whole thing, and if you're missing a cog in the wheel, it's not going to ride the same. So if
Right.
you're
Right.
missing a tooth in the back, you might not think you can see it aesthetically, but in terms of functionally, you're going to feel that hole when you chew. It's
Yeah.
not the end of the world, but you definitely see when you lose a tooth the difference that it makes. Teeth collapse into spaces. So I always encourage people to maintain what you have, and if you can't, it's not the end of the world. But there are options with in 2025 that can get you as close as possible to your baseline.
What advancements or technologies in oral and maxillofacial surgery are you most excited about, and how do they improve patient outcomes?
Ooh, I like that question. So I love the technology. I've been in practice almost 17 years. And
Wow.
before, you had to take the x-rays and dip them in the water and then hold it up and
Yeah.
get it, and if you wanted to measure something, you had to have a calibrated marker in the x-ray. Now you have CT scanners in your office where you can see things three-dimensionally. You can plan surgeries digitally within
Wow.
millimeters. You can create surgical guides stepwise to get from A to Z. You can get a teeth in a day, literally, if you
Mhm.
do the details before surgery digitally.
Mhm.
So the
Wow.
digital technology is superior now, and I'm talking about in the last 10 years. It's just blown up. Jaw surgeries I
Mm.
plan digitally. Used to take me 6 hours on a Saturday to plan my jaw surgeries. So that would be probably the biggest thing.
Wow.
Also biologics, bone grafting materials, platelet-rich fibrin. We will draw blood in the office and centrifuge it, and we get a layer that has rich platelets and fibrin that can help with growth factors to help grafts integrate better. So those are the probably the things that kind of catch my attention mostly in the technology nowadays.
Has there
Okay.
been, just curious about AI, is there any influence um in the dig in your industry?
That's a good question. Mm. I don't really think so. I mean,
Yeah.
I think that anything academic, you definitely can have AI influence because of
Mhm.
research. It's a little bit easier to research stuff. It's a little bit easier to I mean, you can use AI in a bad way, but you can use it just like Google and just help
Mhm.
you to frame your thoughts.
Yeah.
So, I don't really see it clinically. When you like myself, I'm a clinician. There's
Yeah.
really not much that I'm doing with AI. Oh, posts. When you do posts, you can definitely
Yeah.
use AI to help with your posts. Other than
Yeah.
that, I don't
Yeah.
know.
Well, Dr. Watson, those are all of the questions that we have for you today. Do you have any parting thoughts or words for our audience?
Um, yes, I will say that for me, 2025 is a special year because I will be turning 50 years old this year. I'll be turning 50 years old this year. Um, my daughter, she is graduated from college. She's in New York working. My
Hmm.
son is graduating from high school. He will be going to college. I will be an empty nester, and I still feel vibrant. But at the same time, I think this year, in terms of transition for us and our country, is very important for us to just be joyful and understand that God is in control. But at the same time, we got to do the work. And in terms of being a Black man and being in this country, which I'm a citizen of, I think that it is important to take care of your own,
Yeah.
while you are also being a citizen and being intentional and not being scared of that because it's 360 right now.
Yeah.
And when I look at how we can do that, as being Black people, I look at it in terms of the HBCUs and our Greek letter organizations, just to be politically empower ourselves to make sure that we do what's right by our country, but also do right by ourselves. So,
Hmm. Okay.
these are my parting thoughts.
Very.
Well, excellent points and very well said. And thank you so much for joining us here on Earrings Off and take good care.
Yes, thank you. Y'all have a good evening.